All I see is sweet melanin. Idol, idol, idol. You are the African idol. Idol, idol, idol.
It's still live on the Premier Money Show on Volta Premier 98.1 FM. That's Stoneboy with African Idol. So I promise you that I'll have officials from Whole Teaching Hospital. Yes, I have two of them here. I have Abraham Gajanake and George Sedinam Boni. They are from the emergency department. Gentlemen, good morning and thanks for joining me.
Thank you.
I hope you are all doing well.
Yes.
Okay, nice to have you in studio. How is our teaching hospital?
Oh, we are doing well. We are growing slowly. To become a full-fledged teaching hospital.
Okay, that's fine. I understand you have different departments. Sub-BMCs. Oh, okay. What are they?
So I would say that let me say good morning to your listeners, and it's good to be here with you to
nice to have you
share the services that Whole Teaching Hospital is providing. Just as you mentioned, it's a teaching hospital now.
Okay.
You know, some few years back, we were a
regional hospital,
and then we've been recommissioned as a teaching hospital because of the existence of the University of Health and Allied Sciences. So it's a management system. So within the teaching hospital, we have just as you mentioned, departments sort of, but this one is a bigger. It's like hospitals in a bigger hospital.
Okay.
So we are from internal medicine.
Okay.
Actually, we have 5 different sub-BMCs.
Okay.
All focusing on different aspects of care. So we have the surgical sub-BMC also focusing on surgical issues.
Okay.
And we have the obs and gynae sub-BMC that focuses on our mothers and every other issue concerning the reproductive system.
Okay.
And we also have the child healthcare sub-BMC that focuses on children. And then we have what we call the diagnostic sub-BMC that focuses on our investigations that we do in the hospitals, the lab, the X-rays. So they are also sub-BMC on their own. So it's more like a managerial system where the management system is decentralized.
Oh, okay. But you are from internal medicine.
We are from internal medicine, where emergency medicine falls under.
Oh, okay.
Yeah.
So OPD cases, what do they fall?
Yeah, so OPD also falls under internal medicine. But mind you, we have other sub-BMCs also have their own OPD.
Oh, okay.
So ours will be called medical outpatient department. So.
Don't confuse us. But I know the reason is to make sure we understand how you now run, so that in case you want to come there, we know where we are going.
Yes.
We don't get confused in the process. So, okay, that's fine.
Yeah, so I'll say that when you get to Whole Teaching Hospital now, especially you get to the central OPD where you are being registered.
Okay.
Of course, they'll ask you what the issues are. So based on what you tell them, they know exactly where to send you. If you are going to internal medicine, they send you there. If you are going for surgical side, they'll send you. Obs and gynae, they'll send you. So you go to those sub-BMCs.
Okay, so the central point to report to is still one.
It's the one.
But they know where they'll send you.
Of course.
Okay, that's fine.
Yeah.
All right. So you are from the emergency department under internal medicine.
Sub-BMC.
Okay, that's beautiful. What do you do there?
So I would say that internal medicine focuses on issues concerning medicine. Medicine, purely medicine. So there are various clinics that we run, even though we attend to all medical cases. But we have various clinics. So if you have diabetes, we have a diabetic clinic. We have sickle cell clinics. We have asthma clinics. We have even our boss is a gastroenterologist. He specializes on all issues concerning the digestive system. So we have the gastro clinic as well. We have renal clinic. They focus on kidney issues.
Okay.
We have the dialysis. We have the accidents and emergency center that falls also under internal medicine. And very soon we'll start handling geriatric nursing. This focuses on issues concerning elderly people. Yeah, very soon that will be introduced.
Okay. So you don't do that now?
For now, preparations are ongoing.
Okay,
to make
for
that happens.
Okay, let's talk about International Emergency Medicine Day. What is this day about, and how are you featuring yourself into the day?
Okay, let me talk about it briefly, and then I'll allow my colleague to join. So, International Medicine Day worldwide is celebrated on 27th of May. Each year. I would say that's the day modern emergency medicine began. So the day is just set aside to recognize the significance of emergency medicine across the world. And the aim of this is to talk about emergency. Bring the stakeholders together. Let's talk about emergency. How can we improve our emergency system across the world, everywhere? So that's just about emergency.
You are from accident and emergency. What is that? How you call yours?
Yes.
If you say emergency, what is emergency itself? Because for some of us, when you see a car running, that's when you think there is an emergency. But to you, what is it? Is that what we know? Is that it?
So the word emergency means that you are not prepared for it. You are not expecting it, and all of a sudden something happens and one's life is at stake. Or if not your life, parts of your body is at stake. So you need attention immediately. So anything in that situation becomes an emergency.
Something that needs quick attention.
Yes.
Time has not beat us that much.
Time is of the essence to us.
What must it take for someone to be an emergency, let's say, service provider? I mean, the person. What qualities must somebody have like that? I'm just trying to know more about emergency. We'll go to our issue of emergency day. Abraham.
Okay, so for you to qualify to be an emergency healthcare provider, basically you should have a basic knowledge on interventions that could be given to someone in an emergency situation, as described earlier by my boss. Yes, so you should have that basic skills and you should be knowledgeable in that area.
I know about qualification, no doubt about that. Nobody can walk into your facility and say I can provide a service and you take the person on. The person must have the basic requirement. Also, because many a time the people say, and when we go to the hospitals, it's like they don't have the passion for the job again. The acquisitions that come. That's why I asked that question.
Yes. So with that basic baseline setup, you should be patient enough. Should get the accurate history of the person. You should be empathetic towards the person. That is, you should have the feeling of the patient or the person seeking that intervention. Yes, so that you understand better. If you were to be yourself, how would you have solved that issue? So you put yourself in that person's shoe, then you attend to the person.
That's beautiful. Emergency service providers, we are in your hands, so we pray that you
in the hands of God. We are just like vessels.
Yes. I'm sure in the line of your work you face challenges. What are the key challenges emergency service providers or medicine providers face?
Oh yes, just like any other situation. Emergency healthcare providers also face a lot of challenges. Basically resources. We work with logistics. Yes, so as usual we lack some of them once a while, not always. Let's say consumables, the syringes, the needles.
So there's an emergency. You need basic things to protect life or save life, and the things are not there.
Or even if they are there, they might not be sufficient at all times. Yes, and then also we have overcrowding. Yes, overcrowding, and we work under a lot of pressure because of the demands of the situation.
Yeah.
Yeah. So these are some of the challenges.
Okay.
Yes, he has spoken about the resources.
Oh, yeah.
It could not be just logistics; it could be human resources.
Okay.
So we receive large number of cases, and
So
we have no excuse.
Okay.
Like we can predict even 5 minutes or 1 minute in an emergency. We don't know how it will be.
Okay.
So always we have to be ready. So you don't know the number of people that will come, but there's a specific number that at least all EDs should have, which many of our EDs across the world do not have. And just as we said, people must be trained with the required skills to be able to function properly at an emergency. But we are few. Those of us with emergency background are very few in the country or across the world. So that's also another challenge.
Is there a specialized group of medical personnel that work at the emergency?
Yes.
Oh, okay. Yes. Not everybody.
It's not supposed to be everybody, but you need to be trained.
Okay.
You need to be trained to be able to work, because you asked a question about who qualifies.
Yeah.
The attitude is very important. You need to have that agency towards emergency cases. So, as he said, overcrowding is a major issue for us. Ours is to resuscitate and move patients out to the wards, but you see that the wards looks like they are smaller.
Okay.
So the number that we are receiving, we are not able to move them to the wards. So at the end of the day, they stay longer at the emergency, and we have no excuse to say that we are full. We cannot take more people.
Yeah, I was listening to a doctor in Sudan this morning on the BBC, and it's about the number of injured people who were brought to their facility and the pressure under which they must make sure they provide that care.
Yes.
So that's an emergency situation.
Yes.
No rest. You must continue to work until. Selassie is asking a question. He's a friend. He said, "Ask my friends there if they can close and leave accident victims. It has happened before." I don't know if it's in relation to the teaching hospital.
Yeah, but I think I get the point.
Okay.
She's trying to make. So the teaching is that when you are on duty, unless the place is stable or unless the last client is being attended to, you do not leave.
You do not leave.
You do not leave.
Okay.
So the best practice everywhere is, we run shifts.
Yeah.
So if you think that the number of cases available overwhelm your colleagues that are coming, you need to wait, assist them, make sure the place is stable before you leave. I want to believe that that's the point she's trying.
So there is no way somebody will walk away from.
That's not
a very difficult situation.
So you see that the training is key.
Yeah.
To be able to fit into the emergency department is key. Even basic practice also do not encourage that, where people are there to be attended to, and then you will say that it's time for you to close, so you have to go home. So all these things makes us work for a very longer period than usual.
Let's talk about society, stakeholders. The state is a factor here. Traditional leaders, the church, the mosques. I mean, the media.
Yes.
How do you marry our roles, our interests, our expectations of you at the emergency ward? Because when you get there, it's like there are a lot of emotions at play, particularly if somebody is in a critical condition. Sometimes you see that it's heated. How do you manage all of this? And if the support you've been expecting comes from these bodies?
I would say that it's a very challenging environment to work with. So mentally, physically, you need to be well prepared to be able to work in under such situation. You can't predict what will happen in emergency room. So it's like the expectation from us is high. We ourselves, we have so much expectation for ourselves to make the patients, even the management is having an expectation from us, and those come in, the patient, the relatives, they all have their expectation. Everybody's patient. Everybody thinks that his or her patient is very important than any other person. Meanwhile, it's not everybody. That's how everybody thinks. So we have a system, the triaging system. That's when you come, we try to sort everybody out. We try to sort out those with the life-threatening conditions to be able to identify who to attend to first, who can stay for longer for maybe attention, and who needs the attention immediately. So when you come to the whole teaching hospital, we call a unit triaging unit, which is the first point of care that you go to when you come to the emergency. So these people are just there. Their aim is to sort out people with life-threatening conditions, and then they score them and then classify them. So you see that they will classify somebody as red, somebody as orange, somebody as yellow.
What do the colors mean?
So the red means that the person must be attended to now. The person is in danger. Red, danger. So now. Then the orange, it means that within 10 minutes we should be able to attend to this patient. Then the yellow means that within 60 minutes we should be able to attend to that person.
But we will not know.
So we've actually written it in both English and Away. And then pasted it there. But most of the time we do not.
But me, I entered there. My attention will be that attend to my kinsman. So your red and your yellow or your green. If there is even indigo, I may not care.
I get it. So we try to communicate that to people when they come.
Is that where people begin to accuse you of abandoning some of their people?
Of course. But it's not that we abandon, because when you come, something will be done.
Yes.
Do you understand? Something will be done for you. When you immediately come, they check your vitals, they check like your BP, your pulse, your temperature. They check your sugar. Sometimes if they need to go further to even check your urine, because certain things in the urine could determine the time you should be seen. So we do all this to make sure that you are okay to wait for a while or to be seen immediately. These are, I would say, evidence-based practice across the world. And these things come as a result of research, that has been done and proven to improve better outcome.
All right, great. If you just join us, this is Volta Premier 98.1 FM. You're listening to Abraham Gajanaka and George Sedna Boni, all from the whole teaching hospital. We're talking about International Emergency Medicine Day. We're talking about emergency ward and how they go about their duties at the whole teaching hospital. If you have any question, you can send them to me 0577 981 981 0202 981 In the next few minutes, we'll be saying goodbye to you. How is government retooling your center? Are you so okay with your work there? We're talking about stakeholders. You start from government first. How will you describe whole teaching hospital, emergency ward, what the state is doing, so that in case we come in there, we have some level of comfort in our head? What will you say about that?
Okay, thank you very much. Like you rightly said, there are a lot of stakeholders in this call, and we're talking about government. Yes. So for the first thing, government has to set and enforce safety standards. That is one of the things government does in provision of emergency healthcare services. And by doing this, some of the things they do is to ensure that we have emergency preparedness. Yes, so when you go to work, we have systems in place. You have to set up your tray, and the tray is just a flat item that you pack your working tools on. You prepare.
We prepare.
Yes.
For any emergency.
Yes. So it's government's responsibility to set up the standards so that we the professionals will follow them in carrying out our
so I believe is that standard is at whole teaching hospital.
Definitely.
Oh, okay.
Definitely is there. And then also we have something we call implementing patient safety initiatives. Because this year the theme for the emergency day at emergency our place is your safety our priority.
Okay.
Yes, so not just the patient but also the working staff also. And so in implementing safety initiatives, government has to do come out with programs and initiatives, and this include reduction of medical errors. We are professionals. Sometimes, like we mentioned earlier, the pressure over there, you may do one.
So you may make a mistake and all that.
Yes, with the initiatives and these things in place, you as a professional, you also take caution, making sure that whatever you are going to carry out is the accurate intervention. Yes.
You make mistakes sometimes.
Oh yeah,
I hear people say doctors make mistake and people die and nobody talks about it. And drivers make mistake, they kill people on the road.
Well, it's part of this. It's part of these initiatives as we are talking about the responsibility of government. Even there is a room for reporting such mistakes
I know that.
And reporting them accurately. Yes, for
that's fine. We'll be wrapping up. So let's get back to the celebration. That's on 27th.
Yeah.
Yes.
But you've started some activities from 22nd, right?
Yes.
Okay. Can you run us through what you've done so far, which activities are coming up?
Yes.
And then we come back to the hospital as to how people can reach you in times of emergency.
All right. Thank you. Before I get to the activities, I'm so passionate about the government.
Okay.
One thing I want to talk about is funding and providing the resources for our hospitals. And I use your platform to appeal to all the stakeholders, especially our traditional leaders, our politicians, the media, and everybody that has the power to communicate this to our leaders at the top. And I know very soon the political leaders will start trooping down to come and solicit for ideas as to what to be part of their manifestos and what to be part of their agenda for the coming election. And I want everybody in Volta to wear the coats we'll call now Volta. Like, let's wear one coat. Not let's not do MPP, NDC or PPP or whatever. Let's wear one coat and put the agenda forward. That's this is the only teaching hospital we have.
Okay.
And ever since the hospital became a teaching hospital, we've not seen any major infrastructure development. So you see that there's so much pressure. There's so much pressure on the facility.
Okay.
So even though the management of the hospital is doing, putting a lot of effort to just to be able to contain the pressure, we need support from the government.
Support us in
what exactly? Infrastructure development.
Okay.
At least
expansion.
Okay. If you see what was done in Rage.
Okay.
If they can repeat such a thing here, what was done in Tamale, they can repeat certain.
Is it the case that you're having more numbers and you don't have space to accommodate?
Yes. Ever since we've became a teaching hospital, the numbers have doubled, like even tripled.
Okay.
But we are using the same facilities. So all political parties, all traditional leaders should put this agenda forward and let them see this as a priority. Because now, if something happens, they want to refer you to, let's say we don't have the service here. Maybe the personnel who can provide the service are here, but the facilities they need, the resources they need to be able to do that are not here. They have to refer you to Kolebu.
How frustrating can it be in a facility where you are ready to help but you can't help because the resources are not there?
Very, very frustrating. You become angry. That's why the emotions come in.
Okay.
You know, the relatives do not understand why.
Angry with who?
They're angry with you, the provider. They are not angry with the government. They're angry with you, the provider.
Okay.
Because they feel that those things should be available.
Yes, for us, we've come to hospital.
Yes.
Let's say teaching hospital,
Yes.
whole teaching hospital.
Yes.
Big name.
Yes.
So we expect you to flow.
Yes.
So if you are not working, we should be angry, or?
Yes. So we understand you, but
Yeah.
instead of becoming angry with us,
Yeah.
become angry with our leaders at the top. I mean the government, the policymakers.
They are not helping you enough.
You see, they are supposed to provide the resources. We are not supposed to provide resources for ourselves.
Yeah, I understand.
We are trained with the basic skills to come and work. So if you don't give us the resources, how do we work? And now the issues we are having now, if you want to take an ambulance from here to now they calculate it based on the kilometer
Okay.
they are covering, because
So
the
you want
government is supposed to fuel all these ambulances.
Yeah.
But because of the situation we have now, you see, they are not able to do that. So now that burden now falls on who? The patients.
Okay.
And the relatives.
If you want to transport a patient from
Who to, it will take 1,500
to Accra.
to Accra,
Okay.
which is supposed to be free initially,
Yeah.
which they were doing initially. But now you have to foot that bill. But if we have all the resources in our facility here, nobody will be referred to go and do certain things
In Accra.
in our crowd. Thank God, by the government. I want to.
We'll get another time and look at the specific of the resources that you asked for, because it looks like
I will be very happy to be with you to share this. So I think that all the stakeholders, we are all stakeholders. The
Yes.
media, the chiefs, the traditional leaders, our politicians, our administrators and managers, the clients, the community. We
Yeah.
have a role to play. We need to speak up. Let's not be angry with the providers for just they are not able to give the resources. They are not supposed to. Infrastructure development is huge.
it's huge. It
And
can be the
yeah,
workers
so
there.
so if the government can just repeat, let's say they give us what they did at Rage, or the expansion work they did at Tamale Teaching Hospital, at least that will
Like I
really
said,
help.
we'll get another time
Sure.
to talk about that.
So our emergency
Yes, how
medicine
do
day-
people reach your end in case of emergency, the teaching hospital?
So we have some contacts over here that you can call. At the triage unit of the whole teaching hospital, the number is 020-8515-689. I'm taking that again. 020-8515-689. Then we have the customer care unit number 020-808399. Let me take that again. 020-808399.
Okay. Thank you. The activities, you couldn't talk about them.
Yeah, I
Time
can
is
do
running.
that briefly.
Okay,
So, as we said, the day is just to meet stakeholders
Okay.
and then talk about emergency, how we can improve our emergency. So, the first day, which was the 22nd May,
Yeah.
we had a stakeholder engagement with our administrators, managers at the whole teaching hospital, where we discussed emergency issues. Yesterday, we were online, where we had a discussion with our referring facilities in Volta and then OT, and
Okay.
we were surprised. We had participants from all over the country joining us in the discussion. It was very interesting. Today we were supposed to be with one of our sister facilities, but due to crash of programs,
Okay.
we've postponed that one to we postponed it to next week. But today we are using it to engage the public through platforms. So whilst we are here, other people are in other radio stations doing
Also
the
talking
same,
about
the same
okay.
thing.
We're grateful
Tomorrow
for
we are having training for our staff.
Okay.
We need to boost their capacity. And then Friday we have a symposium. We invited all the stakeholders to come and let's talk about emergency.
Oh, okay.
And then Saturday you can join us. We'll have some fun games.
Oh, okay.
All work and no play.
Yeah.
Jack, Dow, person.
Okay.
So thank you very much for giving us your
thank you
platform
also
to reach
for
out
passing
to
through
the community.
Abraham and George from the whole teaching hospital. We're connecting you to the VOA for African Beat. My name is Rastunga.